All right, so here we are. We see the jugular vein on the right side here. Looks like it's pretty much open here. The atlas is not really digging into it too much. The jugular vein on the other side, the atlas is right up against it. And you can see it's diminutive on that side. And the main reason for that is, let's clean this up a little bit better so you can see this. All right, so you could say, I'm sure it's going to be argued that you were born with this, with this hypoplastic left transverse sinus. Okay, maybe you were, or maybe it's acquired. Well, I don't think it was ever the same size as the other, but I believe that at some point it was open, it was patent, and for whatever reason something happened that now if therapeutic manometry would be a benefit. So obviously we would want somebody to come in with a catheter, come across the transverse sinus looking for a pressure gradient, and just by going across with the catheter or with the wire, I think they're going to open this thing up and get it to flow better, and that will, even that little bit, I've seen it make a big difference between having symptoms and not having symptoms. So that's I guess the biggest finding we found. Let's go. So we have these collaterals veins that are obviously trying to help you drain the jugular. Here we see all right, we're gonna have to dissect it again. A little technical difficulty here. Okay, let's see if I can get a better shot of this. All right. So it looks to me as though the omohyoid is being digging in right here. It looks like, and the reason I can, let me get a better shot of this. So right in here, it would be right here, that's where the tendon of the omohyoid would be digging in. I've seen it on other people where it's clear as day. Here, it's a little difficult to see, but that's what they do, is they'll dig in there and they'll cause us to dilate. So we pulled on that today. Today we pulled we attempted to pull the omohyoid out. We also adjusted this atlas from the right. It is stuck up to the right. When we had a CT with your head turned to the right, your head turned to the left, and this atlas is not moving like it should. When you turn your head to the right, the atlas should slide up to the left, and vice versa. And yours is not moving very much; it's stuck. And I don't know that. Yeah, let's see if we can pull this apart for you and show you. So the 34 years of being a pathologist, and looking into a microscope caused a repetitive injury, and right up in here. Let's get that a little prettier. So all this calcified ridge there, that's not what's supposed to be there. That is inured over time. Let's get another shot of it here. There you go. All this calcification in here is not supposed to be there. So clearly 34 years of looking into a microscope tugged on these ligaments in such a way that they got inflamed and calcified. Let's see, I dissected this in other shots. Actually, I've got some pretty good images of it, but let's see if I can get this on the fly. So you can see how one of the facets between C1 and the skull is normal, and the other one is kind of modeled. Let's see here. Yep, you'll be able to see it. I'll get a good shot of it here. All right, so here we are. Look at this facet, that joint space between the skull and C1 looks beautiful, it's pretty. And then on the other side, it's very thin. On our alignment x-rays, you can see that the joint space is still there. It looked like it was fused, but it's not fused. It wants to fuse. And you can see it all through here. All through here, it's kind of mottled and not happy. So we had difficulty getting it to move today. I think we did get it moved. We used the Atlas orthogonal instrument. To get that to move. What else? Yeah, I guess that's the big thing, is that calcification in there. Gosh, that's ugly. Let's get that out of the way. All right, look at all that calcification in there. So all this is extra, all this is extra, and you've clearly lived a life that's loaded this cervical cranial junction in a very funny way. Also, we found that C2 is rotated to the right, C3, C4, and when we look at you, let's get that cleaned up. Sorry. All right. So your there's C2, C3, C4, C5, C4. These vertebrae are stuck in extension. That actually, it's more as if you turn to the left. In a neutral position, these vertebrae think they're turned to the left. Now we did CT with you turn to the right. They do move. And by the way, this is you lying down, and the cone beam from Dr. Hauser, when you're weight bearing, looks just like this. So they're stuck, or they're sliding in that direction. And anyway, so we ended up making an adjustment on those vertebrae. We did the omohyoid, we adjusted the atlas. What else did we do? You obviously you enjoy shooting a shotgun, and so we did examine you for that shotgun blow that goes through there, which I think had something to do with this omohyoid. Be careful with anybody with a jugular vein compression problem. Be very careful with injury to the cervical thoracic junction. Using a shotgun and the blast, the recoil, not cool. Given the compromise you have in the cranial vault that you are either born with of actually, and probably that was your weak link, got compromised in some way. You're very vulnerable to any of these choke points. So you had a choke point at the atlas, choke point at the atlas over here, choke point at the omohyoid here, inside the cranial vault, the transverse sinus, where your most hypoplastic looks like it closed down. So you got 3 dams there. What else did we do? What am I missing? Oh, I did your anterior L5, your lowest lumbar gone too far forward. Yeah, I think that's the gist of it. I mean, here's the, this is the x-ray over here, the Atlas orthogonal alignment view. Oh, that's it. That's what I wanted to show you. Now I know what I remember. I wanted to show you the x-ray where I was looking at that joint space. All right, so this is an ADP open mouth. We see a very, actually, let's do this shot here. There it is. So your structure is very interesting. Structure affects function. Here we have a steep facet and we have a more horizontal facet. And as it being a pathologist, you were head down and then turned to the right, looking at the next slide, and you did that all day long. So it moves a little funny. This joint space, I was scared it was completely fused, but it looks like it's going to move there. We got it to break loose. Before the Atlas adjustment, your right leg was 3/8 of an inch short. After it, it went 1/4 inch long. So the whole frame shifted. We got this thing to move. Your whole body's going to be sore from this. That was the thing. Yeah. And of course, we've got some other interesting things in play. And of course, to be thorough, there's your L5 that was too far forward on L sacrum. That's why when we put you on your back and use the drop table to put that back, that's why you felt so much better. And that's low-hanging fruit there. Any questions, anything else you want me to comment on for your doctors?
Covered pretty thorough.
Okay, beautiful. Here we evaluated your airway, and it is really restricted in the middle of the neck. We're going to send you to a pulmonologist who will do a sleep study on you, probably give you a CPAP machine and pressurize that nasopharynx. That'll help your brain function a lot better and give you a lot more energy.